Vanakkam. Welcome to this course on classics in neuroscience. In this series of videos, we have been looking at the development and evolution of neurosurgery as a discipline or as a subspecialty of surgery. In the last video, we looked at the use of neurosurgery in patients with epileptic seizures. In this video, we will look at the use of neurosurgery in patients with psychiatric disorders or the topic of psychosurgery. Those who have psychological or psychiatric disorders getting surgical treatments. As soon as Victor Horsley performed the first brain surgery in the 1880s, the suggestion to use similar methods to relieve people from psychiatric disorders was raised. And Gottlieb Burckhardt in Switzerland suggested that schizophrenic symptoms were essentially due to excessive excitatory spread from sensory to motor cortical areas and suggested alleviating it by using ablation between them. So, in 1888, he removed small parts of the temporoparietal cortex and reported that patients were calmer and required no isolation, patients of psychiatric disorders such as schizophrenia. Later, several methods were used. One of these was insulin shock therapy, electroconvulsive therapy. These are methods that have been used for a long time. Especially electroconvulsive therapy is still being used. There was limited success, there was some success with these methods. Electroconvulsive therapy as a therapy is still used for treating depression even today. It is just delivering shocks, it is being used even today. Carl Jacobson explored by removing or extirpating the frontal lobe of a chimpanzee. He reported that this chimp and her behavior changed from being an aggressive chimp to a docile chimp, n is equal to 1. We have discussed this in some other, as part of some other discussion in previous videos, but this is an experiment with one participant, remember this. And Antonio de Gasmonis persuaded Pedro Almeida Lima in 1936 to perform what is called as a prefrontal leucotomy, that is using a wire loop to remove or to cut off certain regions of the frontal lobe. He practically coined the term psychosurgery. Of course, this skepticism was there, but D. Egas Moniz had a fantastic reputation as a famous neurologist and as someone who introduced angiography to the field of neurosurgery. So, people did give sufficient credence to his theory, to this idea. So, between 1946 and 1956, 60 to 80,000 psychosurgeries were performed. I think perhaps this was only recorded in the United States, I suppose, I am not sure. The theoretical rationale for performing these was to correct imbalances in the thalamocortical regions or the relationship between thalamus and the cortex. This. Funnily, there was practically no follow up on patient outcomes. So, you perform the surgery and how do you know that the patient even became better? Maybe the patient became better for a month, for a week, or maybe for a year. What happened after that? There was absolutely no follow up. The kind of thing that would be absolutely unacceptable by today's standards. But remember, this was the wild, wild west. The 1940s, 1950s, 1960s, everything was acceptable. Actually, before that, this was actually 1930s, right? So, to perform prefrontal leucotomy, practically no permission was needed. Anybody So, the patient is on the table and the surgeon does what she or he prefers. The same with Wilder Penfield and the ethical conundrum of whether you can perform these kind of experiments on patients who have come for a different purpose. Ethical dilemmas, questions, right. But keep this in mind that there was absolutely no follow up on patient outcomes after these surgeries. The ease of these procedures essentially encouraged other people such as Freeman to apply it even to patients who were simply hyperactive. If that was the method that was used, practically all of us will have to get a surgical treatment today, because almost all of us are hyperactive today. Just kidding. So, by 1960s though, fortunately or unfortunately depending on how you look at it, psychosurgery gave way to pharmacological approaches to treating psychiatric disorders such as depression. Some stereotaxic precise methods are still being used, but mostly treatment of psychiatric disorders now, treatment and management of psychiatric disorders is now primarily through pharmacological agents. Those topics and those approaches have their own controversies, which I will not get into for want of time. With this, we come to the end of this video. In this video, we looked at the use of neurosurgery to treat psychiatric disorders. With this, we also come to the end of the discussion on neurosurgery. Thank you for your attention.